criteria for reopening is whether or not the locality and the people on the ground actually have significant or sufficient enough testing capacity to really know what the transmission looks like at the time of reopening, and if any changes, to be able to mark those. And as our incident commander, Cindy Farr, will discuss later, we are not in a robust situation for testing. We are better, but not where we need to be. The governor's order anticipates that jurisdictions can issue additional more guidance as long as it's more stringent. This has been reviewed by the county attorney for stringency and appropriateness within the law. Pursuant to Montana law, as the health officer, I have a statutory duty that is stated as follows: that the health officer shall take steps to limit contact between people in order to protect the public health from imminent threats, and certainly in a state of an emergency with a pandemic virus, which we are all in some level susceptible to, and no treatment or other preventive agents, then limiting that congregation and contact between people is our most important tool. Missoula is the second largest populated county, and when you look at all the counties in the state, it is a good thing that the law allows for more stringent requirements, and that the governor in his address to the public anticipated that could happen. Missoula is also home to a medical hub, very sophisticated medical hub that serves a region much, much larger than Missoula. A large segment of Montanans rely on that medical hub. Our essential workforce for that medical hub is drawn from our county and outside of our county. One of our incident command objectives is to do everything we can to protect that medical operation that we all rely on. We are all aware that this weekend, or actually midnight on Sunday, we will emerge from the most restrictive tool that is used to slow a pandemic that was appropriately, in my opinion, put in place, and that is an early and strong stay-at-home order of several weeks. We are also aware, and I'm very mindful of the fact, that all epidemiological guidance for lessening the impact of a pandemic and coming out of a stay-at-home, a large amount of suppression calls for very gradual and phased approaches to social restrictions, and for adequate testing capacity, which again is not as robust as I'd like. I am finding this particular phased approach that the governor has issued statewide to, when looking at our community, it needs to be a little more gradual, a little better phased, and certainly be mindful of the fact that our testing capacity is not where we would really like it to be. So given Missoula's large population, our need to protect our healthcare hub, and particularly to avoid the preventable transmission of disease and reduce the likelihood that we would have to reshutter businesses and services, we don't want to go back. I am issuing the following additional and more stringent requirements in Missoula County. The first one has to do with the size of events. The governor's order does say that if you can't practice social distancing, don't have more than 10 in a group. That makes sense. We, of course, will endorse that. It did not give a required in this phase. How large can a group be in this very early gradual phase? So we talked about that and looked at our events, talked to many, but not all of the people that are in charge of those events, or heard from them. We got a lot of incoming comments from folks. And we are limiting events to 25 people in this phase one. Events include, but aren't limited to, fairs, festivals, markets, including farmers markets, concerts, sporting events, races, private parties outside the home. limited to 25 people. The second area that we looked at was something that a large number of businesses that have to do with grooming, beauty, body art, massage, spas, similar services, barbers, estheticians, manicurists. Those were allowed to open in the governor's phase one. Under my order, they shall remain closed until phase two. And we got a lot of information from the public and the providers of this service, and also looking at our larger context, as I just mentioned to you, about what is fitting for Missoula. Those services will not open in Missoula before phase two. Thirdly, we looked at the retail businesses that could reopen under the governor's guidance on Monday. We would like to see those reopen too. But we heard and also judged for ourselves that those businesses, with this short bit of time we've had between learning the guidance and actually opening the business, that the guidance itself doesn't give time or enough specifics about how to reopen and do it safely. So we are allowing the reopen of those formerly non-essential businesses for curbside pickup and delivery only. Those are the only two ways they can open on April 27th. But by the end of that week, we are going to ask those businesses to go through some steps with us and add some additional requirements, not recommendations, but requirements, so that when those businesses do open, particularly with our large population and our large draw to our retail hub, that people are more protected. And those requirements will also apply to businesses that were already open, and those requirements must be fulfilled by May 1st. When they are fulfilled, the non-essentials can reopen to in-store business. The already open stores can remain open, but they're going to have to put in place what we have seen in the last month. And that really is what we believe are the best practices for some of those larger businesses. Those include, at any given time, the maximum number of customers shall be 50% or less of that usual business capacity. We have seen places that have creatively done that, and we have fielded numerous complaints from the public that we have passed on to businesses where there doesn't seem to be a way to implement the guidance. This requires a way to implement. They must also have measures in place that protect customers in waiting areas, checkout counters, waiting counters, anything, so that you don't have to keep saying back up, back up, back up, that you've actually thought that out in advance and your staff is trained in it. Your staff needs to be trained on what is appropriate and good hygiene, what physical distance is in place, and how they are to encourage adherence to that, what symptoms of COVID could look like, and how they're going to check for those before they go to work and not go to work or leave work if they develop symptoms. We have had a cluster in the cases we've had so far that involved numerous individuals in a business, and actually resulted in not only the illness, but that business needing to close because of that cluster. We certainly don't want that to happen and to possibly spread to our citizens. In order to fulfill these steps, there is an appendix to the order. It will be posted online, and it's just a little kind of like a cheat sheet, and it says, what is half of your capacity? What's your plan for physical distancing? Are you going to put tape on the floor or a barricade or a sign? You decide, but do it. And then put your plan. How are you protecting your staff and making sure they're not ill? And then keep your plan on file. When we get a complaint, we will call your business and we'll talk with you about that. Next, we found that the reopening for dining, breweries, distilleries, bars, particularly with the delayed opening there, actually provided better protections than the retail business did. It already had a requirement for 50%. We don't need to change that. We did find a couple areas where it was either guidance that wasn't enforceable, or we didn't seem to fit what we know about our eateries here. And so we are adding some enforceable language in the order. Particularly, the governor's order allows places that are kind of a quick serve. They are advised to do certain things for sanitation and for capacity. We are requiring that even quick serves would follow the guidelines for capacity and sanitation, and for 6 feet of separation between diners in every establishment, including if it's booths. People can't sit in every booth, in our opinion, for safety with the 6-foot guidance. These measures will remain in place until the governor moves the state to phase 2 of reopening, or until we revoke this order or revise it. And how would we revise it? We'll revise it by reviewing the epidemiological data that we talked about transmission, our testing capacity, and the penetration we've had with our population for testing, and our local capacity to do contact tracing, quarantine, isolation, as well as our healthcare capacity to treat people who have become ill. That is the end of what the order says, and it'll be posted online shortly. Thank you.
Thank you, Ellen. So speaking on behalf of the city of Missoula, I can tell you that we have had lengthy discussions since Wednesday, and I believe that a slow and measured opening makes nothing but sense. We don't want to do this all over again. So City of Missoula fully supports this order, and we'll do everything we can to ensure that the community remains safe moving forward. Want to call on other guests here to lend their perspective. And why don't we start with Adrienne Beck.
Thank you, Mayor. You know, from our perspective, things don't change very much in the Emergency Operations Center or the objectives that we have to help the health department meet their objectives and to help support the community. So our call center will continue to be available, 258-INFO, where it's bifurcated and you can speak to a public health nurse, or you can get information about resources that may be available to individuals in the community. We'll continue to do the things that we've been doing as far as securing PPE for our first responders, as well as hospitals and clinics, because while we acknowledge that the environment is changing, the threat from this disease has not. And so our goal will be to continue to provide that PPE to our first responders who are going to have interactions with in the community. We will continue to work with our community organizations active in disaster, as well as continue to do activities that were guided through FEMA.
Thank you, Adrienne. And with us also is Commissioner Slotnick from Missoula County.
Thanks a lot, Mr. Mayor. So from our perspective at the county, we want to say we really appreciate that the governor recognized we're a very diverse state, and places like Missoula with a high population and a relatively high population density are in a different situation than some of our other less populous and less dense counties. And we appreciate that our health officer has the leeway to make the kind of decisions that she did, and we fully support our health officer in these decisions. Also want to reiterate that we feel like we've kind of hit a stride in Missoula County in our ability to deliver services in this new and unusual environment. And we're not going to change in the short term. We're going to continue to deliver the services we've had online, through the mail, et cetera. And our senior leadership team met this morning and reevaluated in light of some of these changes. And we're going to begin to look at how we might change the delivery of some of those services as the situation unfolds. But for the short term, we're just going to keep doing everything as we've been doing. And that's kind of where we're at. Thank you.
Thank you, Commissioner. And for the University of Montana, Ms. Short.
Hi, everyone. Thank you. Very helpful information as we move forward. I think the university will plan accordingly, of course, and just grateful for the collaboration and help. We know that what happens on our campus is certainly affects our partners in the community, so we want to be obviously good participants in this process. So I appreciate the opportunity to join, as well as for the continued support of City County Health and in helping us with some campus-specific issues too moving forward. So again, we will take this guidance and it will shape our planning as we move into phase one.
Thank you, Paula. And from the Missoula County Public Schools, Dr. Watts.
Good afternoon, everybody. Thanks for the opportunity just to say a few words. The school district obviously will comply with the local health order as well. But I do have a couple of other announcements in general with the governor's order and how it impacts schools. As you're probably well aware, the governor's order lifts school closures on May 7th, but he also left it up to local officials to either go back to school or continue in the remote learning environment. And for us, that's our Board of Trustees. So our Board of Trustees will meet a couple times this next week to discuss this issue and make a decision. One of the things that I want folks to know is that we will be presenting our trustees with a list of considerations that we have looked at in order to plan for an eventual reopen, whether it happens this spring or next fall. There's quite a list of things we would need to do to plan for a reopen. We will present that list to our board on Tuesday night at their board meeting. Just a couple of examples that are in that list, things that we're considering. If we were to reopen, one of the things that's been recommended in the governor's plan is that in situations where you can't social distance, you should be using cloth face coverings. And so for us, that means that students either need to bring cloth face coverings with them, or if they're unable to do that, then we would need to supply that. And so for our students, that's 9,200 students and 1,200 staff members that we need to consider using cloth face masks. Another consideration that needs to be planned for is our medically vulnerable students. In the governor's order, he is recommending that those individuals that are in a high-risk category need to stay home. For us, we have about 14% or 1,200 students in that category. So even if we open this spring or next fall, we're going to have plans and considerations in place for that vulnerable student population. Those are just a few of the considerations that we'll be presenting to our school board as they think about this decision and plan for this sort of decision. Just to reiterate, our board is going to meet on Tuesday night at 6 o'clock. We also meet in a virtual format, and we'll live stream that meeting. There will be no decisions made on Tuesday night. It's just simply the first time that the board's had a chance to meet and discuss the governor's order and discuss our list of concerns and considerations. So again, April 28th, Tuesday night, 6 o'clock, but there will be no decisions made. They're going to meet again. They've agreed to call a special meeting on Friday, May 1st at noon in order to make a final decision. We believe that's prudent given the timeline of May 1st and May 7th. So again, they're going to meet at noon on Friday in a virtual format to make a final decision. We know that parents and community members have questions, comments, or concerns that they'd like to share with our board. We have set up a special email address that's available on our website. It's public comment, all one word, public comment at mcps.k12.mt.us. We encourage folks to submit comments to that. We'll print those comments off and have them available for our board right up until before the meeting starts, and also right up until next Friday when they make a decision. And they will be taking public comment before any decisions are made. Thank you.
Thank you, Rob. Representing the Missoula Economic Partnership, Grant Keir.
Thank you, Mayor. I think the first thing I'd like to do is just recognize and thank the community for the vigilance and sacrifice that's been made to get us to where we are today with respect to COVID. It's really a testament to everybody's willingness to cooperate with these regulations and orders that have put us in the position where we are today. And I want to extend our gratitude to Ellen and her team at the Health Department Everything that we see in the data, and it's true that we hear this anecdotally from our businesses, tells us that our recovery economically isn't going to start until we have confidence. And we need confidence for our business owners that they are proceeding down a predictable path that makes their places of business as safe as possible. We need confident employees who feel like they're going to a safe place to work. And we need confident customers who feel like it's safe to do business in our establishments. So I'm grateful to Ellen and her team for providing a roadmap and additional guidance that can give everybody the confidence that we're in a good place to make this slow start and steady start to reopening, and that we can do that in a way that the community can get behind together.
Thank you, Grant. And from the Missoula Downtown Association, Linda McCarthy.
Thank you. Yes, I would echo a lot of what Grant had to say, and want to definitely express our gratitude for the work that the health department has been performing, and our numbers indicate that they're doing a great job. Downtown business owners are interested in a unified guidelines and best practices. They do need more information. They do need more guidance. You know, their priorities are definitely to make sure that their employees are safe, their customers are safe, and that they're implementing the right practices to take care of everybody. What we've heard a lot about is how they really want a calm and confident approach to opening that's community-wide. And it's been incredible to see how these private sector businesses have really sacrificed a lot, and they very much care about the entire health of the community. But there are some challenges that they're going to have to overcome in the near term. You know, again, more guidelines and information, getting their employees back to work, that's going to be a challenge, especially for those who have employees that are taking unemployment benefits. And they're also going to need supplies, the kinds of supplies that will help make the environment safer. You know, and examples include face masks and gloves, cleaning supplies, plexiglass dividers, those kinds of things. So, you know, they're scrambling to figure out where to get that stuff and what the additional costs are going to be. And then they need time to prepare their environments for the public. So our downtown businesses are really grateful for, you know, the work that's been done, and they understand and appreciate, you know, that we all are all in this together. And their goals are the same as everybody else's, that consumer confidence, employee confidence has to be there. So that's it.
Thank you, Linda. Gwen Jones from the Missoula City Council.
Thank you, Mayor. I don't really have a lot to add. I just have heard from numerous constituents who are excited about the reopening, but also very apprehensive. And so I think having more structure from Ellen Leahy is very helpful to figure out how we're going to do this in a methodical approach. And the only thing I would add is I think we need to do all of this with people just need to use common sense, and people need to be rid of each other. If you're out and about, we still need to give people a lot of space. We should be thinking about wearing masks. So just be considerate of each other, and let's use our common sense. And I think those are traits that we can easily fall back on that will help to try and roll this out so that our numbers don't spike, but we can get back to work. Thanks.
Thank you, Gwen. Ross Miller, did you have anything to add?
Thank you, Mayor. Yeah, just that the Board of Health, that we appreciate that the governor granted and actually invited discretion from local health departments to institute stricter reopening measures, recognizing that Montana is not a one-size-fits-all state. And it seems like the Missoula community has really come forward and would feel more comfortable with stricter measures. And the Board of Health, very much supports the health officer, Ellen Lee, very much supports her orders that implement stricter measures for this phased reopening than those advanced by the governor. So,
thank you, Ross. Cindy Farr, you want to back cleanup?
Yeah, so thanks Mayor Engen. I also want to say thank you to everyone out there in our Missoula communities for everything that you've been doing to help us slow the spread up to this point. We also appreciate and want to say thank you for the engagement and the feedback that we've received from businesses and members of the public as we've worked on trying to make these really difficult decisions over the last couple of days. And thank you for your patience, because I know a lot of people really wanted the information from us right away after the governor decided to move us into phase 1. And so thank you for working with us while we had a couple of days to try and work out how we could best serve Missoula County populations and businesses. I also just want to reiterate that it is going to take all of us working together to stay the course and slow the spread and to adapt to a new normal. We're not going to be able to get back to business as usual. We are going to have to adapt to a new normal. And so I just want to say we appreciate everyone's cooperation in trying to stay the course here. We want to remind people to please continue to practice good personal hygiene measures and community protective measures as we're moving forward. Just because we are starting to open things back up does not mean that the virus is gone. We still need to do what we can do to protect the most vulnerable in our communities. And so please continue to keep that in mind moving forward. I want to encourage people who are having symptoms of COVID-19 to get tested. We do have some testing capacity in our county to test people who are having symptoms. We're still working to increase our testing capacity at this time, and we are still experiencing some challenges with getting those testing supplies. So for now, we are able to test people who are having symptoms, and we are continuing to move forward trying to increase our testing capacity. To get tested, if you're having symptoms of cough, shortness of breath, or fever over 100.4, you can call our 258 info line Monday through Thursday to schedule an appointment for a test, or you can visit one of our other designated testing clinics in our community, and those are listed on our COVID website at missoula.co/cvirus. Right now, the reason that we're really emphasizing testing is that contact tracing is going to be one of our best methods for controlling the spread of this disease. So it's just really important that we continue our continued vigilance, and sustained human behavior changes are going to be the best tools that we have to continue the slow of the spread. And we will likely see more cases as we start to reopen Missoula County. But we want to ensure that we keep the number of cases that are manageable. So again, thank you for everything that everyone's doing in our Missoula County communities to help us in public health to continue to limit the spread of this disease.
Thank you, Cindy. And with that, I'm sorry, Rob?
Yeah, sorry, Mayor Engen. I apologize. I forgot probably a key important point, if I might.
Please.
So I mentioned that our school board will be meeting next week. Very thoughtful and deliberate thinkers. Our board asks really good questions. But I do want folks to know that most importantly, they will keep the safety of our students and staff in our community in the forefront of their decision-making process. They always do. But I also want folks to know that based on my concerns related to some of the considerations and the planning that will need to go into reopening, and also based on the safety risks to our staff and our students in our community, I will make the recommendation to our board that we do not reopen this spring, that we put our time into planning, and that we reopen next fall, and we'll stay in remote learning. That would be my recommendation, to stay in remote learning for the remainder of the school year. But again, it is a board decision, and I know that they'll spend some time next week and weigh the pros and cons and make the best decision.
Thank you, Rob. So with that, I am happy to open this up to questions from the press. If you would raise your hand, please, in Zoom, and I can call on you in that order if you use that hand raise feature. And I'll see you in my list. By the way, we have 88 people on the call, so the press corps has grown considerably over the course of the last few weeks. All right, and if the hand raising feature isn't working, why don't you raise your hand in real life? And so Stella, I see you, go ahead. Stella, I think you're on mute.
Hi, thanks, Mayor. And this question's mostly addressed to Cindy Farr and Ellen with the Missoula County Health Department. Are you guys considering requiring people to wear face masks if they do go out in public? Other cities and states have implemented that, and I was wondering if that's something you guys have considered, will consider moving forward, or will that depend on the case numbers?
I'd like to ask the chairman of the Missoula City County Health Board, Ross Miller, to answer that because the board did deliberate and issue a recommendation a couple weeks ago.
Thanks, Ellen. Yeah, this is Ross Miller. Yeah, the Board of Health deliberated this issue just last week, and we issued I think the way we phrased it was a strong recommendation for workers of essential businesses that are in contact with the public and the public when they are in situations where they can't social distance to wear face masks. It hasn't elevated to an order yet. The way we phrased that Board of Health recommendation was that our hopes were that we wouldn't have to issue such an order, but we are keeping an eye on it. Basically, our goal is to try to normalize face mask or face covering wearing. So I think we're gonna basically monitor the situation and see what to do about it. I think you raise up a really good point. I think it's something the community should be very attentive to in reopening. That I think it's something we need to keep a very close eye on, and I don't think we see a reticence to issue such an order or to encourage such an order if we feel the need to. So, thank you.
I've got Maritza.
There we go. I just wanted to kind of clarify in the first part of this order, events and gatherings limited to 25 people. I know it mentions markets, so should we assume that the May 2nd opening of our markets is postponed until now, or is there going to be some kind of capacity there?
Well, it does include the farmers market. So the way they have operated in the past, where it's basically an event and people come to it, could not occur. I am aware, but can't speak for some of the work that they're doing to try to make fruits and vegetables available by other means. And I know I have also talked with Commissioner Josh Slotnick, and of course his background in all of that. I would defer to him, but we do believe there's ways to do that. We also believe that to be safe in this careful opening of phase 1, that the 25-person limit needed to be in place. So that does include farmers markets.
If I could just add a response to that, we do know that businesses and other people like farmers markets are going to have some questions about how this affects them directly. And so I just want to let people know that our environmental health staff are going to be here for a couple of extra hours this evening and part of the day tomorrow, I believe from 8 to 2 tomorrow. And people can call 258-4755 and talk to someone in our environmental health staff that can help them figure out how this is going to directly impact their own business or things like farmers markets.
Thank you, Cindy. Connor, can you hear me?
Yep, I can. Thanks, Mayor. So Ellen said more stringent requirements. Do you believe that the ones that the governor has are too light?
Well, the governors are for the whole state. And so to give another level of protection to the state's largest, second largest populated counties, and to allow the preparation you've heard us discussing, and to have the testing, contact tracing capacity that this large county needs, we do need to add more requirements. The governor's requirements may be a perfect fit for other counties. Small counties may find them too steep. But for this county, in our situation, have determined to add more requirements and time for preparation.
Can I follow up with something?
Sure.
That seemed to be the governor's goal, was to kind of leave it up to the individual counties. Did you agree with that then? Is that helpful to you guys here in Missoula County?
Oh, I don't know if it's a matter of agreeing or just looking at what the current data shows, understanding that he's doing that statewide, and that our county, for all the reasons I've given, obviously repeatedly, is probably going to need the highest level of protection.
Patrick.
Thanks. I have two questions. Number one, will places of worship be allowed to open on Sunday as spelled out in the governor's order, provided that they maintain the various social distancing requirements?
So I didn't add any additional requirements in the local order. And so then places of worship are guided by the governor's directive.
Okay. And then my second question, do any of you have any update on the Missoula Marathon?
I do not.
Okay. Martin.
Yes, good afternoon. How do you justify keeping portions of Missoula closed when Yellowstone County, a much more larger and equally urban county, is going to follow the governor's directives? Aren't you concerned that might put our businesses at an economic disadvantage when the rest of the state is going to be opening?
Do I have a concern about economic disadvantage? My concern about economic disadvantage would be to do something that will lead to reshuttering businesses. So that is my concern.
And a follow-up question, the governor's recommendations yesterday gave no timeline for phase 2. Several businesses under ordinance will remain closed until phase 2 is issued. That could be indefinite period of time. Nobody knows. How is that? I mean, what would you tell them saying that there's no definitive timeline to allow you to reopen?
So to quote Dr. Fauci, the virus sets the timeline. So what the criteria are in both the Opening of America plan and the state plan, and as I mentioned in our preface here of whereases, is you look at the epidemiological data and you look at how transmission exists, how it's changing, and how that affects our local capacity. And you can only do that if you have robust testing. So I think Cindy could probably speak to the fact that we are just beginning to test the population in our community. I mean, would you want to speak to that, Cindy, about the priority 3 testing?
Yeah, so what Ellen is trying to talk about is that just last week on Tuesday is when we were actually able to open up our testing to people who do not fit into a high-risk category and are not working in a high-risk setting. So we have barely started really testing members of our population that fit into those categories. So what that tells me is that there are probably a lot of people out in the Missoula communities that were not able to get tested up until a week ago. And so that means that we are still doing case finding in our communities. And as we start to open things back up, it is quite possible that we could see a spike in cases because we do know it's in our community. We haven't had the testing capacity that we really need in order to know exactly how much we have in our community. And so as we move forward, and as I said before, we're also having still having some struggles getting the testing supplies that we need and knowing when we're going to be able to replenish those testing supplies. And so what that tells us is that, we really need to be very careful moving forward, because the more cases that we see, that means that likely that's more testing that's going to need to be done. And at this point, we've fairly hit the tip of the iceberg as far as testing in our community.
Last question, follow up on that. Tester and Danes this week said Montana got $5 million for testing and contact tracing. Has that not made any difference in Missoula County to increase testing?
So Martin, I will tell you that we are agitating daily with the state. Testing is a huge issue for the leadership team. And so we've been advocating every day to try to get more tests because that is the way that we ensure safety. We've been trying to track down 500 swabs that were allocated to Missoula County for the last couple of days. While we hear about testing supplies being available at the federal and state level, we're having challenges finding them here on the ground to put to work. So we'll continue that agitation.
Thank you.
Mr. Mayor, could I add something to Martin's question?
Yes, please.
So Martin, I would just encourage you to flip your question around and how could Yellowstone County keep things open and take this risk when Missoula County has gone otherwise? I think that question is just as valid.
Additional questions out there, Connor?
Yeah, so we mentioned Yellowstone County, and then I'm kind of including Cascade County into this too. They're both also medical hubs for Montana. That seemed to be a big deal for Ellen when she was talking about why Missoula is doing what we do. Are you talking with those areas then and consulting with them too, or are we just taking our own direction?
So I consult with the large counties. So the 7 largest counties health officers. We actually have a professional organization called the Association Montana Public Health Officers. It's called AMPHO, and we have a large caucus part of that. I am no longer an officer in that. Some of my colleagues are, I have been an officer, but we have been communicating with each other since before we had our first cases. However, the public health system by statute and design in Montana is a decentralized system. It is not a centralized system. So wherever we can be consistent and it makes sense for our community. So you might recall it was the large counties that first put some closure orders out. So most of us had 2 kind of stair-stepping closure orders before the governors and then before the stay at home. And then we each look at our county. We've all had a lot of different rates. And then we decide based on what the governor puts out for stair-stepping down, do we need to step down more carefully? And that's really all it is that matter of degree.
Further questions?
I have some business questions if I can toss those in.
Sure, Connor.
So this is kind of for either Grant. Have businesses been consulted on if they can continue making money with all the requirements put on them?
So, Connor, I think what we've tried to do is have businesses at the table right now to talk about what they're feeling in terms of strain and pressure. These directives have just come out. I know that a lot of businesses have reached out to us to ask for clarity on how to do things. I think what businesses perceive as an equal risk to more stringent guidelines right now is a lack of clarity on how to move forward. So I think that Ellen's done a really good job of providing that really tough balance of getting the health considerations right with respecting the needs of our business community to have that kind of clarity and balance their economic needs.
Additional questions out there? I don't see any hands up in the list. I don't see any hands up on video. I'm sorry, Samantha?
Maybe if I could, Mayor, if Ellen wanted to add anything, I think, Ellen, you have specifically talked to individual businesses. So if you wanted to talk about that.
Yeah, we did do some reaching out. Again, it was very short. We got the guidance the same time the public did and the business did. But we had already, through our environmental folks, reach out to particularly the businesses we're most familiar with. But aside from that, we received both through my email, both through our call center, the county and city, you can write a contact. In the last day, the majority, the strong majority, of messages that we have received have been for going more gradually and more clearly. I mean, I'd already was looking at doing that and thinking it might be more difficult in terms of garnering the majority's population to do it, but the messages have come in. We want to go more gradually, more carefully. We want to cooperate, but we don't know how to cooperate. Now, I can't say that's everybody, but those are the people that reach out to us in the hundreds.
Thank you, Ellen. Other press questions this afternoon? All right, a couple of quick notes. One is I appreciate the recommendation that Dr. Watson will provide to the school board. City of Missoula supports that recommendation. We believe there are way too many moving parts here for schools to reopen safely. We continue to support health department and these orders, but there is a ton of information available to you all beyond this press conference. And Cindy can reel off all of those by rote. If you have additional specific questions, those folks in environmental health and the health department are going to continue to be available to you. Certainly reach out to our offices as well at the city and county if we can be helpful. But there are all sorts of resources at 258-INFO. And Cindy, any other places you want to point people?
Yeah, I would direct people to our website at missoula.co/cvirus. That is where the actual health officer order will be posted along with the appendix. And we do have additional guidance there. And as Mayor Engen just pointed out, we do have environmental health staff available a little later in the evening tonight than we usually do, and also part of the day tomorrow to help answer questions for businesses or people that want to know how this impacts them. And that's at 258-4755.
Thank you, Cindy.
You can also follow us on Facebook under the Missoula City County Health Department, and we will be posting more information there as well.
Thank you. Leadership team, anything else for the good of the order as we approach the top of the hour?
I think Evelyn has a question.
Evelyn?
I'm not pressed core, so I don't know if I'm allowed to ask a question. It's okay.
Well, we've got 78 people on the call, so as long as not everyone asks a question, we can probably handle it. We may have to have a town hall or pursue some other options, but go ahead, Evelyn.
Okay, thank you so much. First of all, I want to thank the city for taking a conservative approach. I very much appreciate that, and I think that's warranted with what we're seeing from COVID-19. I'm not an epidemiologist, though, and will happily admit that. But the thing I wanted to ask was, we're seeing this virus have a asymmetric effect on certain demographics in our community, namely people of color and lower income people as well. This virus is not the great equalizer that it has been touted to be in certain situations. What are we doing? Of course, we need to first protect our first responders and medical personnel that are in high contact with dangerous viral particles. But what are we doing to also protect some of our most vulnerable populations? Are we simply doing cloth masks? And if so, do we have specifications to ensure that those are actually providing reliable means of protection?
So Adrian Beck may want to take a run at that, Evelyn. So we have our COAD task force is working pretty relentlessly on those issues. And I don't disagree. There are people at an enormous disadvantage every day in our society. And this illness is cruel, and they are at greater risk. So that COAD group, I think, continues to work particularly among folks who are unsheltered. As you know, through considerable controversy, we ensured through the Missoula City Council and working with our partners last week that we had a place for people who are unsheltered to safely quarantine and isolate and be cared for outside of the hospital setting if they don't require it. And that was a big step, I think, in the right direction, but we certainly have more work to do. And I'm happy to have any of the other professionals weigh in.
Well, we also have Partnership Health Center, sees people on a sliding scale, and that means, and no one gets turned away. for this type of care. Our testing clinic is operating through generous donations from numerous local entities, both hospitals, Rocky Mountain Lab. We don't charge for those tests. We want those. We want to do more of that testing and find out, really what does the infection level look like in the community.
Okay, and with that, ladies and gentlemen, we are at the top of the hour. I want to thank you all very much. Thank you for the community leaders who are available and here today. Thank you all for participating, members of the press, members of the community. We are going to keep plugging away here, slowly, cautiously, systematically, but we will be the better for it. Again, you have lots of contact information and opportunity to review these materials and ask questions. So thank you all very much. If weekends even matter anymore, I hope you all have a good one. Stay safe, and it's still okay to stay home. Thank you very much.